Good evening, and welcome to the VA Ann Arbor Healthcare System's Women's Health Teletown Hall. Thank you all for joining us tonight. This event is all about giving you a voice, hearing your thoughts, your experiences, and your concerns. Our goal is to make sure your healthcare experience is positive, supportive, and open. If you are joining us by phone and become disconnected, you can call back at 855-962-1203. Again, that phone number is 855-962-1203. If you'd prefer to stream the event online, you can visit access.live/VA Ann Arbor. Again, that is access.live/VA Ann Arbor. Hello, my name is Deb Hinton. I'll be helping guide the discussion tonight. I'm a social work supervisor and the post 9/11 M2VA program manager here at VA Ann Arbor Healthcare System and the VISN 10 M2VA program lead. I will be the moderator for tonight's call. Joining me as panelists are Dr. Jenny Kreisman, Facility Director, Dr. Kathleen Dusan, Women's Clinic Director, Nurse Cheryl Allen, Women's Health Program Manager, Nurse Linda Nobelsdorf, Women's Health Clinical Coordinator, Ms. Erica Montresor, Supervisory Program Analyst for Clinical Informatics, Dr. Minden Sexton, Women's Veterans Mental Health Coordinator, Dr. Naomi Kane, Health Psychologist for Women's Health Clinic, Dr. Deborah Haney, Environmental Health Physician, Dr. Rachel Messias, Physician and Clinical Director of Whole Health, Ms. Tangela Phillips, Supervisory Program Analyst. This is an interactive forum, and we truly encourage your participation. We will be taking as many questions as we can throughout the call. To help protect your privacy and avoid any accidental sharing of personal information, the questions will be read by me, your moderator. If you would like to submit a question, please press *3 on your phone at any time. Again, if you would like to submit a question, please press *3 on your phone at any time during this call. You will be connected with a member of our team who will take your name and question. If you are joining us online, you can type your name and question right below the streaming player. We will be asking a couple of interactive poll questions during the event, and we'll give you specific instructions when it's time to respond. With that, I would now like to hand it over to Dr. Kreisman, VA Ann Arbor Healthcare System's Facility Director. Dr. Kreisman?
Thank you, and good evening, folks. Glad to see you here this evening. I know there's so many other things that you could and should be doing, but you being here tonight is a welcome and refreshing and great to hear from you. This evening, we're going to be talking about our new federal electronic health record. It's an upgrade. For about 25 years, we've had a system that we home built here in the VA, but it's time to move on to a record that can help us communicate with our other partners within our community, but also more importantly, our military partners in the DOD or DOW. So welcome for coming here. I really appreciate it. You might have noticed if you've been around the healthcare system over the last 2 or 3 weeks that we've been actively working to prepare for this electronic health record so that it can be a smooth transition from one record to the next. What does it mean to you? It means that in some things that will be a lot more easier for you as we move forward, such as being able to pull your records from the military, to be able to communicate with our military partners. So we have all the information and possibly save you a little bit of time and effort in that. And then also, better communicate with our community partners because, as you know, especially as women veterans, we often work with our community partners to provide services. Staff has been diligent. Our go-live date for the changeover is April 11th. We really appreciate all your efforts in supporting this event, and we want to share with you some of the things that are going to happen in the next few days, next few weeks, so that you're prepared. I want to also let you know that we have patient advocates and a resource guide that's available that can help you, such as how to order your prescriptions during this time frame and how to get ahead of things a little bit easier. So after that, we hope to be post-live in the middle of April and be moving forward from that point forward. The whole Michigan market is going live on this new record. So every one of the facilities in the Lower Peninsula of Michigan will be going live, including our Toledo facility and Findlay facility down in Ohio. So this is just me welcoming you, appreciating you for everything you've done for our country, everything you do today, and just thank you for giving us this feedback today so we can better serve you. Have a great day and have a great evening, and I'm going to turn it over back to you, Deb.
Thank you, Dr. Kriesman. Tonight our spotlight will be on the Federal Electronic Health Record modernization efforts here at VA Ann Arbor. I'll now hand it over to Erica to get us started. Erica?
Thank you, Deb. Good evening. I want to take a few minutes to talk to you about the new Federal Electronic Health Record, or the Federal EHR, and what it means to you as a veteran. At its core, the Federal EHR is a modern system that securely stores and shares your health information. What makes it different is that it connects to the Department of Veterans Affairs with the Department of War and other federal agencies through a single secure record. This means your medical information can move with you more easily from your time in service and throughout your life as a veteran. This helps your provider see a more complete picture of your health. While our previous system has served veterans for many years, this new system gives us stronger tools to coordinate care, enhance patient safety, and reduce gaps in communication. It allows your care team to access more up-to-date information, which can help avoid duplicate tests, streamline referrals, and support better informed decisions about your plan of care. Most importantly, this transition is about improving your experience and the quality of care you receive. I'd like to share something just as important. What is not changing? Your doctors, your nurses, and care teams are not changing. The VA facilities where you receive care are not changing. Your eligibility for VA healthcare and benefits is not changing. Our mission to serve you remains the same and is not changing. This effort didn't happen overnight. VA staff has spent years preparing by training employees, testing the system, strengthening security safeguards, and refining processes to make sure we're ready. We've learned from each step and continue to make improvements as we move forward. Most of this transition is happening behind the scenes, but a few quick steps can help ensure your information transfers correctly. Make sure your contact information, including your phone number, mailing address, and email are up to date in your VA profile. Check that your legal name matches what's on your official ID so that records link properly. And if you're transitioning from active duty, confirm that your information is accurate in both VA and the Department of War systems. Because this is a large and complex technology transition, there will be a short periods of temporary downtime to some digital tools. These interruptions will be temporary, and we are planning carefully to minimize inconvenience. Here are a few important dates to keep in mind. Secure messaging will be unavailable starting April 4th at midnight and will return on April 13th. Online prescription refills will be unavailable starting April 7th at midnight and will return on April 13th. But please note that you can still request refills in person, by mail, or by phone during that time. The automated pharmacy phone system will accept referral or renewal requests until April 6th at 7 a.m. and refill requests until April 10th at 5 p.m. Both services will be back on April 11th. And from April 6th to June 6th, the automated pharmacy phone system will not send prescription reminder calls or text messages. These reminders will resume on June 6th. We understand that downtimes to any support tool can be challenging, but please note that these downtimes are only temporary. To help you stay prepared, the resource guide summarizing these dates and contact points to help with accessing care and support is available on social media, in the monthly newsletter, on our facility webpage, and in all outpatient clinics. If you have questions, please contact 734-769-7100 and request to speak to the Patient Advocate Office. Keep an eye out for the resource guide with key dates and support information. We're excited to bring this modernized system forward because it strengthens our ability to serve you today and for years to come. Thank you for your service, your trust, and the privilege of caring for you. And with that, I'll hand it back to Deb.
Thank you, Erica. A lot of change, but that's a lot of helpful information. I just wanted to remind our audience that if you would like to pose a question to the panel, to please press *3, and you will be transferred to one of our staff who will take your question and add it to the queue. All right, we're going to take our first question from the audience. And the first question we're going to take is from our online veterans. Julie is asking, VA called today, canceled my appointment for next month, and rescheduled it for July. Is community care supposed to give you a referral to an outside doctor? Who would like to take this question?
Hi, this is Dr.
Julie.
Priestman. I don't know all the information and don't have all the contact information. And as we've indicated, we are going through a transition right now. However, if you work with your primary care doc and cannot wait till July, then yes, we can see what we can offer for you.
Absolutely. Thank you so much, Dr. Kriesman. Julie, if you want to, if it was your primary care, please contact primary care. If it was specialty care appointment, please contact that specialty care office and request that they follow up with you about that appointment. And if you have any concerns or issues, you can call the Ann Arbor VA and ask to speak with the Patient Advocate's Office. They can help you resolve that concern. We're going to go to our next question. The next question we have from Carrie is, I had breast cancer and had breast implants. I have no doctors for follow-up care. What do I need to do to get proper follow-up care? I feel like none of the doctors are listening to my concerns.
This is Cheryl speaking. The question I guess I would have is, does this particular veteran have a primary care provider? If they have a primary care provider, that would be one that they would follow up with primary care. That's a great start. Then if there are other issues, we could do referrals to some of our other specialty clinics. But the baseline is to reach out to your primary care provider. If you don't have a primary care provider, then we would like for you to enroll to get assigned with a primary care provider, and you can work with the eligibility office to do that. If anybody else wants to add anything that I may have missed, please feel free to do so.
Thank you, Cheryl. The next question is, are your doctors being briefed on stage 4 prolapse?
This is Dr. Dusan. I can take this. Depending on the type of prolapse the veteran is referencing, we do evaluate for that in the Women's Health Clinic and offer various forms of treatment. If interested in having this reviewed and evaluated in Women's Health, that can be done with myself, Dr. Bell, and we're also in the process of getting urogynecology to see women. They currently see women veterans at the VA. They're going to be also seeing them very soon in our women's health space. So that is a service that's offered. And then the different forms of treatment from there can be discussed, including pelvic floor physical therapy, surgery, and pessaries.
Thank you, Dr. Dusan. Our next question is from one of our online veterans. It says, what government agencies will have access to our health information, and what other personal information could be accessed?
Hi, this is Dr. Creasman. I can defer to Erica on this one, but I would offer that nothing should change with regards to what access to personal information that is shared. This benefit that the new electronic health record is that it allows us to pull. We've always been able to get your information from the military, but it's always taken a lot of steps and paper and faxes and all those things. This allows us to work more electronically together. However, information sharing should not change from what it is now into the new electronic health record. So same privacy expectations, same expectations for how we manage your information will be here now and when we move to the new electronic health record.
Dr. Creasman's correct. Nothing's changing other than it should be a lot easier and seamless for information to flow.
Thank you so much, Erica. Our next question is, with the new EHRM, will I have to register at each facility?
I'm going to defer to Erica on this one, but the benefit of us all being on the same record, I believe, allows us to share information more equitably among ourselves. So if you're in Saginaw and you want to get your care here, it's much easier for me to go in and see your information and pull that information forward when you come to see a specialist at, say, for example, here in Ann Arbor. So there are some benefits to it, but I don't know if it's completely, if it addresses the eligibility. I'd have to defer to somebody else on that one.
I'm not sure about the eligibility part, but once everyone's up on the same record, it should be pretty seamless and you shouldn't have to register at each site.
Correct. And currently, because we're at 16 live sites, we're adding 4 more in April. There's still many other healthcare systems across the nation within the VA that are set to go live in the next few years. Therefore, your best task that you can do if you're going to be switching, or your best action you could do if you're going to be switching healthcare systems within the VA, is you contact your primary care physician, ask them to enter a traveling veteran referral for you. We will make a referral to the receiving VA. We'll ensure that all of your specialty care is handed off to them as well. And then they will contact you to schedule your new patient appointment with the new VA healthcare system and get you squared away with all that specialty care. Again, that's a traveling veteran referral request through your primary care provider. And you can do this if you are going to be transferring to another area for 6 months or more, or if you're going to have a permanent move. We can move on to the next question. It's from one of our online veterans. Will hormonal care treatment going to be provided? So Jackie's asking about what hormonal treatment is available through the VA.
I can address that. This is Dr. Dusan again. We have hormonal treatment available at the VA. This is in context of premature ovarian failure or perimenopause or menopause. And there's different ways that people can access this care. One is through virtual visits, where you talk to one of our women's health physicians. We also have a class, a menopause class. We talk about transition in perimenopause and menopause and different forms of treatment available, not just hormonal, but also hormonal treatment.
Thank you, Dr. Dusan. Okay. So we have another online question. Dr. or Terry Toko, if you might be able to provide an answer to this. If not, I might be able to assist. It's from our online veterans, and it says, how may I get an electronic copy of my DD-214?
Yes, hi. This is Terry, and I can answer that. You can actually, if you call our VBA, Veterans Benefits Administration, toll-free number, they can take your information. That would be through a FOIA request, but we have our electronic records, and if your DD-214 is in there, we would be happy to provide that to you. So let me get you that toll-free number. It's 1-800-728-1000. And I'm just going to double check that. Let's see what we got here. Yep, 827-1000. Apologies. Let me say it again. 1-800-827-1000. I hope that answered your question.
Thanks so much, Terry. All right, the next question we're going to go to is, after this record launch, will it be easier to go to the Lansing VA clinic for labs if I go to VA Ann Arbor?
Hi, this is Erica. I'll take that question. Yes. With it being one record, it's seamless and it'll be much easier to get care at different VAs.
Thank you so much, Erica. Next question, and then after this question, we'll go ahead to a poll question. Our next question is from Ashley. Ashley is asking, what is the VA taking in outreach and benefits in rural area for women veterans? Accessibility and outreach is the concern for rural veterans.
We continue to have an outreach group here within the VA Ann Arbor healthcare system. Ms. Catherine King is one of our leads in outreach, as well as most of us that are on this call have some type of role in working and making sure the information is disseminated through to our rural areas within the VA Ann Arbor catchment area. And so we do participate together as working, and also working with our Michigan market, and as well as Ohio, to make sure that we continue to make services available, letting the veterans know what's happening in within the VA. Finley is ideal, with Dr. Kreisman and others, for a future visit, to make sure that we could offer even more rural services to folks that live near the Finley, Ohio outpatient clinic. Just that distance between Toledo and those veterans in that area. So that made a significant difference. So we continue to provide outreach information and also participate in outreach events within our market. And if anyone would like to add anything else, feel free to do so.
Of note, I would offer Reisman that we do, the Secretary has made this one of his initiatives, is to really do that outreach to our rural veterans and to provide those services to them. And I expect to see additional initiatives coming out here in the near future. So just know there's just many ways to contact us. but we will be doing some outreach here in the near future. Thank you.
Thank you so much, Cheryl and Dr. Kreisman. We're receiving a lot of great questions tonight. Thank you, and please keep them coming. Again, press *3 to speak with one of our team to submit your question. If we run out of time with tonight's call, we will be following up with each of you and your questions that you asked to be able to help you with an answer. We're going to move on to our first poll question. The first poll question is, before today, had you heard that we are transitioning to a new electronic health record system? Press 1 for yes, I am already aware. Press 2, I had heard a little about it. Press 3, no, this is my first time hearing about it. Again, the question is, before today, had you heard that we are transitioning to a new electronic health record system? Press 1 for yes, I was already aware. Press 2 for I heard a little about it. Press 3 for no, this is my first time hearing about it. Okay, thank you so much. While those responses are still coming in, we will move on to additional questions here. Again, thank you for all of your responses. Your feedback is so valuable. It gives us an idea of how best to support you. We've had a lot of great questions tonight. Keep them coming. We're going to go ahead and move on to some more questions here in the queue. Again, press *3 if you would like to ask a question. The next question we're going to go to is from Deanna. Deanna is asking, what is the VHA doing to ensure Pap smears are being completed, offered to female vets that have had previous medical issues in the pelvic area?
Hey everyone, this is Rachel Messias. I'll give Dr. Dusan a break. I'm one of the primary care doctors on the yellow team. So the relationship between you and your primary care doctor is an important one, and the primary care doctor should be making sure that all of your preventative cancer screenings are being done. And as I tell my patients, I want them to also know what preventative cancer screenings are coming up in their future. And so having a relationship and talking about it. The VA offers Pap screening both in primary care and through the Women's Health Department. We also have a population health management program where one of our other physicians is in charge of looking at our population on a whole and how many of our patients are receiving appropriate preventative cancer screenings. And if you're not, we actually do then have our nurse care managers and our primary care doctors reach out directly to you to let you know that you are due for that and to make an appointment to come in.
Thank you so much.
Kane, women's health psychologist. And I also wanted to just mention in our women's clinic, we also talk about trauma-informed care. So the varying experiences that veterans have, especially women veterans, that can make these appointments more difficult. And we talk about this, with our residents, along with some strategies to make these, often uncomfortable exams go more smoothly. And so something that we've also discussed with our general primary care colleagues as well.
Thank you so much. All right, our next question is, I noticed, this is from Kelly. Kelly asked, I noticed that the app, my dates of service are incorrect. It says to call a number if this information is incorrect. I called and was not helped. They told me it doesn't affect anything. Kelly, we're going to respond to your question in twofold. One, we'll give you an answer from the Veterans Health Administration side, and then Ms. Toko, if you're able to give an answer on the VBA side. since you can have an app for both within the va.gov, the VA app. So on the VHA side, you can contact the eligibility office or Kelly if you are going into the clinic to be seen. You can stop by eligibility and enrollment and speak with a representative in person. They will ask for you to show them a couple IDs that have your full legal name. And if further correction needs to occur, there's some additional steps to take, and they'll walk you through that. Terry, what would be the recommendation on the VBA side?
Thank you for that question, Kelly. Most likely, I think it is a VHA appointment. On the VBA side, we have it's a Vera tool, so we can take appointments either in person or virtual, and it's all through the system, and our veterans make that appointment when it's convenient to them. But if for some reason that was canceled, I would suggest making a alternate appointment. Kelly, I hope that answers your question, and thank you for your question.
Thanks so much, Terry. And also, both systems verify your information against your DD-214. So if there happens to be incorrect information on your DD-214, you would have to fill out a DD Form 149 to correct military records. So that is another step. And Kelly, if you are a veteran receiving care at VA Ann Arbor Healthcare System, you can definitely stop by our eligibility enrollment office. You can also ask to speak with a patient advocate or a VA social worker, and we'll help you to continue to problem solve this issue. We're going to move on to the next question. The next question is from Lisa. Lisa called the local VA to confirm an appointment. They have her middle name wrong. How does she fix this? Lisa, the answer to your question is similar to the answer that we did for Ms. Kelly, and so hopefully that information helps you. All right. Bear with me a moment here, everybody. We have a question here for our whole health team on the call. Lori in Grass Lake wants information on whole health and therapy at Ann Arbor, yoga, Tai Chi. Are those classes in the community or at the VA?
Hey, this is Dr. Messias. I'm the clinical director for Whole Health. Thank you for your interest in Whole Health. We're really happy that as a VA healthcare system, we're embracing this model. Whole Health is really meant to give people access to skill building and to also empower you to take charge of your health and wellness. So yes, these are available. We do not have all offerings available at every CBOX, so it's very dependent. We have yoga at Canton, Ann Arbor, and Toledo. But we also have virtual yoga. So if you're unable to make it to those CBOX, you can come in through a virtual programming that happens concurrently with the live class. We also have Tai Chi at multiple locations, and Tai Chi is not yet available virtually. The way that you would connect with these is you can give your team a call. Primary care doctors and nurse managers can refer you to our whole health pathway that teaches you about how to enroll in these classes. We prefer, although it's not required, to do an introduction class, which talks about the whole health model. It's available in person and virtually. Again, if you know what's important to you in terms of what you're looking for, you do not have to attend that introduction. The reason we like veterans to attend it is that it does go over why we're doing this, what offerings we have available to you, and there are many. Outside of the ones that many veterans know about, like yoga and Tai Chi, we also have walking groups and art for wellness, and so that introduction class can give you kind of all of those offerings. The other thing I always encourage is we have classes that help veterans focus on what matters most to them. They're called Taking Charge of My Life and Health classes, and they go through different areas of our life that affect our health in very important ways that as a primary care physician, we don't always have the time to discuss in detail in our visits. So we utilize the variety of other professionals that are available. In some cases, these classes are veteran peers to veteran peers. Other options, we have our coaching. Our health coaches are amazing. They help you with any SMART goals that you're working towards for your health and life. And so I guess I could talk about this for hours, but my biggest advice is to send a message to your primary care team. The nurse can refer you to a whole health introduction, or if you know what you'd like, or if you'd just like to know more, they can refer you to our nurse. Her name is Julie, and Julie can call you directly and go through every offering that's available if you can to make an introduction class. I hope that answers your question, and thank you for your interest in whole health.
Thank you, Dr. Messias. All right, it's time for our next poll question. How would you like to receive updates about this transition? Press 1 for monthly newsletter. Press 2 for social media. Press 3 for facility website updates. Press 4 for in-person updates at visits. Press 5 for mailed letters. Poll question number 2, how would you like to receive updates about this transition? Press 1 for a monthly newsletter. Press 2 for social media. Press 3 for facility website updates. Press 4 for in-person updates at visits. And press 5 for mailed letters. And for those streaming online, you'll find the poll just below the streaming player. We love to hear from you. So far, it looks like you are in favor of monthly newsletters, coming in at 45%. Social media is coming in at 8%. Facility website updates is coming in at 10%. In-person updates is coming in at 8%. And mail letters is coming in at 30%. So it looks like newsletter, letters, social media, website, and then, of course, in-person is coming up towards the bottom. Thank you so much for putting your vote in the queue. We will take this information back and use it to adjust how we reach out to our veterans. Again, thank you so much for participating. Your questions and responses help us better understand your healthcare concerns and what matters most. Your questions are very much encouraged, and we have a lot of questions here in the queue. We're going to try to get through as many of them as we can throughout the rest of the call. Press *3 to go ahead and ask a question, and one of our staff will take your question as well as your contact information. So we're going to move on to the next question from our online veterans. It says, how will the electronic system be able to be accessed by community care partners? Erica, would you be able to help with that one?
I can try. I don't have all of the information on this one, but it should still be somewhat similar to now with some of the community health partners where they exchange through the system. Okay.
And Tina, your question in regards to how the electronic system will be accessed by community care partners, there is still going to be the blue button that allows you to sign releases and be able to link your community providers to your VA providers. If the community providers are within the electronic portal, they'll be able to see things real time. There's also an indicator on the VA app that allows you to grant permission for a provider to be able to see certain parts of your electronic medical record for a short period of time. So that's a new feature that you should be able to see either now or you're going to be able to see it by April 11th. So take a look at that, explore that, and then feel free to stop by our Welcome Center. We have a staff in the Welcome Center that are skilled with the secure messaging and the VHA app, and they'll be able to show you all the functionality. And if you are out in the community and don't come to the main hospital and you would like to get linked with one of our staff that are experts in this information, you can feel free to contact the Ann Arbor VA. You can ask to speak with the My Healthy Vet coordinator, or you can ask to speak with patient advocates or social work, and we'll be able to help facilitate you getting the information that you're looking for. We'll go ahead and move on to the next question. Oh, goodness gracious. Sorry, it moved around on me. If my doctor stated I needed a specific treatment, say pelvic floor therapy, for example, but I haven't been referred to a facility for this, what steps do I need to take to be seen?
Hi, this is Cheryl speaking. One of the things, if you have a primary care provider here within the system, you can always ask for your primary care provider to put a consult or a referral into for physical therapy, aka pelvic floor therapist. We have an excellent pelvic floor therapist that's on staff here. She's been here with us for a few years now, and her specialty is pelvic floor with women as well as male veterans, but she has gone to school for extended teaching in regards to how to care of women with pelvic floor issues. And so we get excellent responses back on the services that our veterans experience with the pelvic floor specialist here. So I would highly encourage you to talk to your primary care provider about putting in a referral/consult to physical therapy for pelvic floor therapy. Thank you.
Thank you so much, Cheryl. We're going to go on to the next question from Mary in Saginaw. Mary in Saginaw is asking, female vet with dense breast tissue. I was told to follow up with MRI or ultrasound, but health provider has not referred her for an MRI or ultrasound. How does she get that referral? And it looks like Mary is calling from the Saginaw area. So if you could take that in consideration when you are providing your response.
Again,
Dr. Dusan. Oh,
thanks.
Go ahead,
Thank you.
Cheryl.
So you go ahead.
Okay. Yeah, thanks for the question. I don't know all the details of how Saginaw would work. Certainly here, if there was a need for a breast MRI or if it was indicated for either genetics or a follow-up, certainly women that have been diagnosed with breast cancer that need to have follow-up breast MRIs, that's done through, at least in this VA, it's done through community care. And so the MRI would be placed through community care to get the breast MRI done. Again, I don't know all the details of Saginaw, but here that's how it's run. Thank you.
Thank you, Dr. Dusan. The next question is, why are our community care appointments not visible in the app for showing the schedule? I'll see if one of our panelists is able to answer that, but in the interim, I do know that as we move forward into the electronic health record and some of the changes to VHA, community care is going to be striving to put the appointments that are scheduled within the community, within your VA appointments for it to show on your record. However, it just takes some time to adapt that. So the goal is to have those appointments show up in your scheduling on the app. However, not all of them are going to show up. So if you're in a program that has regular reoccurring appointments, your initial appointment in the community will show up on your VA app. But any follow-up care to see that specialist in the community, those won't show up on the app because those are being scheduled between you and your community care provider within the auspices of the eligibility and the approved services. So that's where the differential is there. So hopefully that answers your question, Anonymous. And we're going to move on to our third poll question. The third poll question is, in the last year, have you experienced or witnessed harassment during your time at VA Ann Arbor Healthcare System? Press 1 for yes, 2 for no. Again, the question is, in the last year, have you experienced or witnessed harassment during your time at VA Ann Arbor Healthcare System? Press 1 for yes, press 2 for no. And one more time. In the last year, have you experienced or witnessed harassment during your time at VA Healthcare System? Press 1 for yes, 2 for no. And a reminder to those streaming online, the poll prompt can be found just below your streaming player. All right, it looks like the results from our poll. Right now, 95% of our veterans that are voting on the poll, 95% say no. They have not experienced or witnessed harassment during their time at the VA. And it looks like about 6% is saying yes. And we still have some votes coming in, so it is changing a little bit as we go on. So please feel free to continue registering your vote in the queue, and we'll go on to additional questions here. Our next question is, how do you change women's clinic to women only? There are men in there. How do you change your PCP?
Hello there, this is Cheryl again. I want to let you know, if you don't know, that at the VA Ann Arbor Healthcare System, we were very fortunate to have a ribbon cutting service back in April 13th, 2023, where we do have a clinic embedded within the facility, and it is located down from the central elevators and next door to our new coffee brewery. So we do have this clinic. This clinic is definitely dedicated to our women veterans. And we have all female providers who work within our clinic, and we do offer services Monday through Friday with primary care embedded within our flow, as well as our subspecialty clinic, gynecology, and also a PAP clinic. We also have the pleasure of teaming up with Whole Health and offering acupuncture on one of the days that are in the clinic. And we just had a new female provider. She just started her acupuncture clinic within the Women's Health Clinic. So if you are interested and you feel that this is the clinic that would suit your needs, please feel free to reach out to us. And you can reach us at area code 734-845-9656. Oh, God. 83. My dyslexia is coming in real quick.
It's 734-845-3983.
I knew it was coming in. Thank you for the 3983. Thank you so much. Yes.
Yeah.
But other than that, you can also, ask for your AMSA to tell them that you, the receptionist or clerk, that you would like to switch your primary care provider, and you can do that. Thank you.
Thank you, Cheryl. The next question is from Twanetta in Sterling Heights. Twanetta is asking, attending Pontiac VA community-based outpatient clinic, has tried to speak with her PCP, needs to get back into therapy, depression issues. How does she get referred? Twanetta, my apologies. You can call the Detroit VA and request to speak with a mental health clinic. You can self-refer to mental health at any of the VAs by contacting the VHA that you are intended to be seen at, so Ann Arbor, Detroit, Battle Creek, Saginaw. You can request to speak with mental health, and they should assess and provide additional appointment and times for you to be seen. They can coordinate with primary care mental health. They can put specialty referrals into the different specialty clinics within mental health and work with you that way. For combat veterans, you can also be seen at your vet centers. There's a vet center there in Pontiac, and it can be confusing because the Pontiac Vet Center and the community-based outpatient clinic are in the same building. And so sometimes our veterans don't realize that they were wanting to be seen at the vet center versus the VA healthcare clinic. So there is a vet center there as well. If you're a combat veteran, you can contact your local vet center, and they will do an intake and get you scheduled for care there as well. And you can also contact any of the VHAs in Michigan or within the nation. Each VHA has a patient advocate's office, and the patient advocate can assist you in resolving your issue and make sure you can get connected to the appropriate care in a timely manner. All right. The next question is from Christine. Christine is asking, if these records become digitized, if we are traveling, can we be seen at another VA hospital? Sorry about this. I believe we answered Christine's question earlier, and it just got moved within the queue. Again, if you are traveling and you need to be seen at another VA hospital prior to your departure, you contact your primary care physician or your primary care team. Your primary care team can put in a traveling veteran referral. They will request from you the date range of when you're going to be in another area. They're going to ask you the address of the location where you're going to be at, and if you know which VA you intend to be seen at. With that information, they'll make an interfacility referral and allow for you to get connected with the local VA for you to have medical support while you are traveling. And you can be duly enrolled at more than one VA only in the event that you are going to be in another area for greater than 6 months. If you are not going to be in the area for greater than 6 months, then it's just a traveling veteran referral, and those services can be coordinated for you.
And Deb, I just would like to add too, and to say that what we call JLV, Joint Legacy Reviewer, is not going away. So that's still going to be a part of the system that we can utilize, and as well as other VAs, to be able to connect all the dots with your electronic medical record as well.
And this is Dr. Christian. Just to follow up, the Secretary's goal is for us to be completely on the same system within the next 5 years. So I think if we're successful and we do really to kind of demonstrate to the rest of the world how to do this and how to move it forward, you're going to see this rapidly move through the healthcare systems, and we will be on the same system again.
Thank you. Our next question in queue is how is our VA medical information being used by the Department of War, and will they have access to it at will?
So from a perspective, our information, again, has not changed anything from when the CPRS. The only difference is we'll be able to, as opposed to asking you to go get this information, and Terry Toko can speak to it a little bit when it comes to benefits and CMP exams, the goal will be is that we'll be able to pull this information from the different healthcare systems such as Walter Reed that are part of the Department of War and bring those to our healthcare system. So I think there's some I don't see anything changing again when it comes to the privacy expectations. I'm not aware of any expectations in that goal. The goal is that as veterans are departing the military, that we will be able to pull them into our system and support them more effectively, quickly, and also reduce some of that red tape. And I would defer to Terry if she has any others to offer.
Yeah, thank you, Dr. Kreisman. I would agree with you. What we expect to see are gaining efficiencies, and we believe that this will help with expediting the processing of claims. So I hope that answered the question.
Yeah, I don't see them pulling, once you left the military, I don't see them pulling the information back. It's more coming back to us. But again, still the same expectations when it comes to privacy. Thank you.
Thank you so much, Dr. Kreisman and Terry. All right. We are winding down on our time. We have time for one more question. Actually, we don't have time for one more question. My apologies, everybody. I'm looking at the clock, and it says 6:58. We're officially out of time. Thank you so much for joining us this evening. We really do appreciate your time and the thoughtful questions we received tonight. Your participation helps shape how we support women in our care and truly means a great deal to us. If you didn't get a chance to ask your question, don't worry. You can stay online after the message and leave your name, phone number, and your question. A member of our team will follow up within the next week or so. Be sure to leave your contact information. You can also check out our facility events page and social media channels for more information. We will be posting a helpful resource guide along with the results of tonight's poll. A link to the audio recording of tonight's call will also be made available with details on how to access it posted to our Facebook page. Again, thank you for being part of tonight. We appreciate you, we hear you, and we're here for you. Please stay on the line if you'd like to leave a message. We will look forward to connecting with you soon. Thank you again for participating, and have a great evening.